Now, let's start by managing stage 1 of labor. Is it clear? Stage 1 labor management. So now, when you manage the stage 1 of labor, you need to know that what stage 1 is divided into latent phase and active phase. Is it clear? In the latent phase of labor, is it clear? Generally, you do nothing into the patient. You do nothing. The simple thing that you can do in the latent stage of labor, is it clear, is to promote effective contraction. Is it clear? You promote effective contraction. Is it clear? You need to know that what there is the explanation under the cervical dilatation. There are mechanisms under cervical dilatation. There are mechanisms under cervical dilatation. Is it clear? And then the mechanism under cervical dilatation is one, the fetal head pressing at the level of the cervix. So the first mechanism is that the fetal head is pressing at the level of the cervix. Is it clear? That's the first mechanism of cervical dilatation in labor. The second mechanism in cervical dilatation is that the uterine contractions. When you have effective uterine contraction, not just any type of uterine contraction, but effective uterine contraction. Is it clear? When you have effective uterine contraction, it also promotes the cervical dilatation. Is it clear? And now the third one now is cervical maturation. Cervical maturation also promote the cervical dilatation. Is it clear? So those are the three major elements which are going to promote the cervical dilatation. Now let's start with the first one, the fetal head pressing at the level of the cervix. So how can you promote in the management if you want to make sure that generally I've said that when you have a patient in stage 1 of labor, in the latent phase of labor, you do nothing. Is it clear? The only thing that you can do is to counsel the patient such that the stage 1 can go a little bit faster. Is it clear? But still in the normal range. So what are the things that you can counsel? You can counsel the patient to stand up usually and walk. You ask her to stand up and walk. Is it clear? When you ask her to stand up and walk, it's going to promote the fetal head to continuously press at the level of the cervix so that it can cause cervical dilatation. Is it clear? Now the second one is to promote also effective uterine contraction. To promote effective uterine contraction, actually you use an antispasmodic. Is it clear? Antispasmodic. Is it clear? Example is fluoroglucinol. You use an antispasmodic fluoroglucinol. Is it clear? Tablets. One tablet every 12 hours. Is it clear? What is now the role of this antispasmodic fluoroglucinol? It is important because what? If you have haphazard uterine contraction, like in the case of Braxton-Hicks contraction, you have what is called the Braxton-Hicks contraction. And Braxton-Hicks contraction are they are forced labor contraction. You have Braxton-Hicks contraction. They are forced labor contraction starting as from 28th gestation because of the production of prostaglandins, because the lungs of the child start to be maturing, and there is production of sphingomyelins and prostaglandin products which are going to activate those contractions. Is it clear? So from 28th gestation, there is already some contraction of these women. Is it clear? And these contractions are called ineffective contraction. When there is ineffective contraction on the cervix, it does not. When there is ineffective contraction on the cervix, it does not dilate. Is it clear? The only contraction that makes the dilatation of the cervix are effective contraction. So you must prevent those ineffective contractions from acting at the level of the cervix, at the level of the uterus, to prevent the cervix from dilating. Is it clear? So that's why you give antispasmodic to this child, so as to prevent those ineffective contractions and to make sure that only effective contraction can promote the dilatation of cervix. Now, the question is, you need to know that what Braxton-Hicks contraction can be stopped by using antispasmodics, but the normal labor contractions can never be stopped. The labor contraction cannot be stopped by using antispasmodic. Is it clear? That's why when you use antispasmodic to the patient, it's always going to prevent the Braxton-Hicks contraction as a forced labor or the ineffective contraction. But the good labor or the effective contraction is never going to be prevented by the antispasmodics. Is it clear? The only thing that prevents the good labor, the contraction of good labor, are called tocolytics. Is it clear? And you don't use tocolytics in this case. Is it clear? You only use tocolytics provided you have a preterm labor or you have an indication for using tocolysis. Is it clear? Now, the third management is the cervical maturation. Is it clear? So generally, what are the counseling that you can give in a patient in order to promote the cervical maturation? To promote cervical maturation, the simple counseling is a simple sexual intercourse. So sexual intercourse can also promote cervical maturation. Why? Because in sexual intercourse, the sperm of the semen of the male contain prostaglandins, and those prostaglandins are capable of maturing the cervix. That's one. So at home, this is what the woman can do in order to promote the latent stage of labor. The second thing is that when the woman comes, you can do cervical stripping. When the woman is at the hospital, you can do cervical stripping. Is it clear? Cervical stripping. Is it clear? And in that cervical stripping, what you do is that you just strip the cervix. You just try to stimulate the cervix. You just stimulate the cervix. Put your finger inside the vagina. You do a vaginal examination, then you just stimulate the cervix. Is it clear? That's called cervical stripping. Now, when speaking about the cervical stripping, there is a technique. There's a particular technique that have been taught, and that technique is called the Ewing technique. Is it clear? Ewing technique. The Ewing technique is actually a woman that I've seen in the Limbe Regional Hospital doing her particular technique. And this particular technique is going to promote the latent stage of labor and even the active phase of labor. It's called the Ewing technique.